Hi students, welcome back to my channel, and today we are going to discuss the topic posterior triangle of the neck. Okay, so let's begin. So first things first, the region where the posterior triangle lies is the posterior part of the side of the neck. Okay, so let's have a view at the bones forming in this region. That is, this is the mastoid process, this is the lower end of the mandible, the hyoid bone, the clavicle and the sternum. So here lie the two important neck muscles that is the sternocleidomastoid, this being the sternal head, the clavicular head, as well as here you can see the trapezius muscle, right, coming from the superior nuchal line going right up to the clavicle and the scapula like this. So this triangular area enclosed in between these two muscles is your posterior triangle. Okay, so let's enumerate the boundaries. The anterior border is formed by the posterior border of the sternocleidomastoid muscle. The posterior border is formed by the anterior border of the trapezius muscle. The base or inferior border is formed by the middle 1/3 of the clavicle, and the apex lies here at the superior nuchal line where both these muscles, the trapezius and the sternocleidomastoid muscles, meet. Okay, so these are the boundaries. Now this triangle is subdivided into two portions by this muscle, which is the inferior belly of omohyoid. Okay, so this whole triangle is divided into an upper larger triangle known as the occipital triangle and a lower smaller triangle known as the supraclavicular triangle, also known as the subclavian triangle. Okay, so having seen these subdivisions, let's talk about the structures which are forming the roof of this triangle. Okay, so the skin covering this region will be the first layer, the skin, the superficial fascia as well as the platysma muscle. Now the superficial fascia of this region contains certain structures, that is certain cutaneous nerves, which I shall be drawing in this schematic diagram over here. Let's say this is our don't worry, I'm not teaching trigonometry. This is our posterior triangle. So this is the trapezius, this is the sternocleidomastoid, the clavicle. So certain this will be your omohyoid dividing it. So from roughly the middle of the sternocleidomastoid muscle, some cutaneous nerves emerge like this and supply the region of the head and neck. Number one is the lesser occipital nerve. The second nerve will be the great auricular nerve. The third nerve is the anterior cutaneous nerve of the neck, which will hook around the sternocleidomastoid muscle like this and cross over to the anterior triangle of the neck, where it divides into its ascending and descending branches. And the fourth cutaneous nerve lying in the superficial fascia over here is the supraclavicular nerve, which will pierce the fascia over here and divide it to three terminal branches, that is the middle, medial, intermediate and lateral supraclavicular nerves. So these are the cutaneous nerves which will be a part of the superficial fascia and thus form the roof of this triangle. Now apart from these structures, the cutaneous nerves, the external jugular vein is also a part of the roof. Here it will drain into the subclavian vein. So it terminates into the subclavian vein, and this part of the external jugular vein lies in the posterior triangle. Now deep to all these structures and the superficial fascia lies the deep cervical fascia, and that too its investing layer. So the investing layer of the deep cervical fascia. So these were the structures forming the roof of this triangle. Okay, now let's talk about the floor of this triangle. So again we have our posterior triangle like this. Now the floor of the triangle is formed by a whole lot of muscles from above downwards. The first muscle over here is the splenius capitis. The fibers run diagonally like this, and just above this muscle you may also sometimes find muscles, the fibers of the muscle semispinalis capitis. So the first muscle would be semispinalis capitis. The next is your splenius capitis. The next muscle forming the floor is the levator scapulae muscle. So this is the levator scapulae. And then you have the scalenus medius muscle. Also over here there are some fibers of the scalenus anterior muscle as well as sometimes a few digitations of serratus anterior. Okay, so all these muscles from above downwards form the floor of the posterior triangle. Now one important point to note is that all these muscles are covered by the prevertebral layer of the deep cervical fascia. Okay, so the term used is that these muscles are carpeted by the prevertebral fascia, that is all these muscles are covered by it. Okay, so now we come to the contents of the triangle, which we will look at one by one. First let's talk about the contents of the occipital triangle. So it got its name from the occipital artery which travels or passes through the uppermost part just near the apex. This is the occipital artery. Okay, next you have a whole lot of nerves which occupy this triangle. The most important being the 11th cranial nerve or the spinal accessory nerve. So this is the 11th cranial nerve, the spinal accessory nerve, and this is sometimes described as the genuine content of the occipital triangle, because all the other nerves are basically just cutaneous nerves mostly and smaller nerves. This is the highest and genuine content of the occipital triangle. Now just below and parallel to the spinal accessory nerves run two other nerves from the cervical plexus. They are the C3 and C4 nerves, spinal nerves. Okay, so they run just below and parallel to the spinal accessory nerve. Apart from that, all these four cutaneous nerves that we talked about in the roof are also a part of the content before they pierce the fascia. So your cutaneous nerves from the cervical plexus that we enumerated were the lesser occipital nerve, the great auricular nerve, the anterior transverse cutaneous nerve of the neck, as well as the supraclavicular nerves. Okay, but apart from that, a nerve from the brachial plexus, that is the nerve to rhomboids, also known as the dorsal scapular nerve, is also a part of the occipital triangle. So all these nerves form a main part of the content of the occipital triangle, and the spinal accessory nerve is said to divide this whole posterior triangle into an above carefree zone where you can see there are hardly any contents, and a lower careful zone where there are a whole lot of nerves and the other vital structures over here that we are going to talk about. Okay, so now let's talk about the contents of the supraclavicular or the subclavian triangle. So this is your posterior triangle, and the supraclavicular triangle lies here in the lower part, where the main content are the subclavian vessels, that is the subclavian vein and the subclavian artery, because of which it is also known as the subclavian triangle. Now, apart from these, the three trunks of the brachial plexus, the lower, the middle and the upper trunk, also pass through the supraclavicular triangle. Then you have a few other nerves which emerge from the brachial plexus. Okay, so from the upper root, firstly you have the nerve to subclavius. This will be the nerve to subclavius. Then you have the suprascapular nerve, also arising from the upper trunk, the suprascapular nerve. We all have already seen the dorsal scapular nerve, that is the nerve to rhomboids, which has traversed to up to the this occipital triangle. Now, apart from these two, there is another nerve known as the long thoracic nerve, which supplies the serratus anterior muscle. Now, this arises from the C5, C6 and C7 spinal roots and will go down like this in to supply the serratus anterior muscle. So, this is the long thoracic nerve. So these were the branches from the brachial plexus that occupied this region. Now, apart from this, we have already seen that this is the external jugular vein, which will terminate into the subclavian vein, as well as certain tributaries of the external jugular vein are seen over here. And we find a few branches from the subclavian artery, that is 2 branches from the first part and 1 branch from the third part of the subclavian artery are seen over here. So the branches from the first part are the transverse cervical artery as well as the suprascapular artery. Okay, and the branch from the third part is the dorsal scapular artery, right? So these are the main contents of the supraclavicular triangle. Apart from this, you have a whole lot of lymph nodes which are particularly present near the posterior border of the sternocleidomastoid muscle, and these often get enlarged and infected. Okay, so now I shall be talking a little about the clinical anatomy of this region. Now, first and foremost, the most important structure which is traversing this region is this spinal accessory nerve. Okay, and you must remember one point, that here it has a very superficial course, like it is almost plastered to the investing layer of deep cervical fascia. So whenever the surgeon has to approach the posterior triangle of the neck for any incision and drainage of any abscess, or for the lymph node dissection, or if there is any stab wound in this region, this nerve, the spinal accessory nerve, is often injured, and the muscle that it is going to supply now will be paralyzed, that is the trapezius muscle. Okay, so this is a very commonly asked PPG NEET question, where clinical questions are formulated as in, so when if a person has undergone a minor abscess drainage surgery, and after that surgery he is unable to abduct his shoulder above the head, or unable to comb his hair, unable to shrug his shoulders, so what is the reason behind it? So now you know that the nerve that is injured is the spinal accessory nerve, the muscle that is paralyzed is the trapezius muscle. Okay, so remember this point. And the spinal accessory nerve is the most common iatrogenic cranial nerve injury that occurs. All right, so that, and also you must also know that here, since a whole lot of lymph nodes lie belonging to the deep cervical group of lymph nodes. They are also often enlarged in any head and neck pathology, and the lymph nodes of the left supraclavicular region are particularly enlarged in a whole lot of abdominal malignancies. Okay, these are known as Virchow's nodes or Troisier's nodes, and these are enlarged in gastric carcinomas, CA breast, and then carcinomas of the testes, etc. So this is also a clinical point that we must remember. Apart from that, now this external jugular vein as well as the internal jugular vein, which lies deep to the sternocleidomastoid, basically lies in between the two heads of the sternocleidomastoid muscle, the internal jugular vein. It is approached in this region for measuring the venous pulse, which is known as the jugular venous pressure and jugular venous pulse. Okay, so it is a direct reflection of the pressure of the right atrium, and since it is can be superficially approached over here, so it is a commonly employed tool. Okay, so that finishes the anatomy of the posterior triangle. Hope you understood each and every point, and you will revert back to me and share and subscribe to my channel. Thank you so much.